Welcome to this session on the muscular system. In this module, we will cover the types of muscle tissue, the different types of muscle fiber, how muscles contract, the different muscles in the body, the effect exercise has on the muscular system, and considerations for special populations. So, if you're ready, let's begin. There are three types of specialized muscle tissue in the body: skeletal muscle, cardiac muscle, and smooth muscle. These muscle tissues all have different roles. Skeletal muscles are responsible for producing movements in the body through voluntary actions. These muscles are striated in appearance, which is caused by the presence of functional units called sarcomeres. The sarcomere is the smallest unit of the muscle and contains protein filaments called actin and myosin. The interaction of these two proteins enables the sarcomere to shorten and therefore cause the muscle to contract. Numerous sarcomeres placed end to end make up filamentous protein bundles called myofibrils. Bundles of these myofibrils make up muscle fibers, with each muscle fiber being encased in a connective tissue called the endomysium. This tissue plays a role in transferring force produced by muscle fibers to tendons. Muscle fibers are then further organized into bundles called fascicles. The fascicles are surrounded by another connective tissue called the perimysium. Organizing muscle fibers into fascicles enables the nervous system to trigger a specific movement of a muscle by activating subsets of muscle fibers. Finally, bundles of fascicles are encased in a fibrous, elastic tissue called the epimysium to make up a muscle. These muscles are then connected to bone by organized bundles of collagen called tendons. A structure that is extremely important to know is the specialized sensory organ called muscle spindles. These are located within the belly of skeletal muscles between the muscle fibers. Muscle spindles play an important role in the regulation of muscle length and can protect the body from injuries that are caused by overstretching of a muscle. For example, when you accidentally roll your ankle, there is a rapid stretch in the muscles and spindles within the ankle. Because of the speed of the stretch, the spindles send signals to the nervous system to contract the stretched muscles, which prevents overstretching. The muscle spindles protect the ankle in this case, as rather than a torn muscle, you will probably be left with a minor sprain. As well as enabling our body to move, skeletal muscles are responsible for stabilizing joints in order for our bodies to maintain correct posture, storing glycogen to be used by the energy systems when needed, and also producing heat to help maintain our core body temperature. Smooth muscle tissue is found in a multitude of structures around the body, including the digestive system, the urinary tract, and the reproductive system. This type of tissue is involuntary, i.e., its actions are controlled directly by the autonomic nervous system under unconscious control. It forms part of the walls of most vessels and hollow organs and is responsible for moving substances through them by coordinated sequential contractions. As its name suggests, smooth muscle is unstriated. Cardiac muscle, or myocardium, is the name used to describe muscle tissue of the heart. It is found in the walls of the heart's chambers and adjacent vessels such as the aorta. The function of cardiac muscle is to pump blood rich with nutrients and oxygen to the body's various tissues. It is structured similarly to the skeletal muscle in that it is striated, but it's like smooth muscle tissue. It's involuntary, i.e., the autonomic nervous system controls its activity. This allows the heart to automatically contract at differing rates in response to demands placed on the body from activities such as exercise. Now, skeletal muscles are actually made from several different types of fibers that all have distinct characteristics, making them better than others at specific tasks. They vary in the following ways: color, capable force, and speed of contraction. Muscle fibers can be divided into the following descriptions: Type 1 muscle fibers, which are also known as slow twitch or slow oxidative fibers. Type 2A muscle fibers, which are also known as fast oxidative fibers. And type 2B muscle fibers, which are also known as fast glycolytic fibers. First, we will take a look at type 1 slow oxidative fibers. These fibers contain a large amount of myoglobin and red blood cells, and because of this are red in color. Myoglobin is an oxygen-binding protein that stores oxygen and speeds up the delivery of oxygen to mitochondria within the muscle cells. These fibers also contain a large amount of mitochondria and are surrounded in capillaries which supply required oxygen. They are highly resistant to fatigue and can produce continuous low-intensity contractions. In order to produce contractions, these muscle fibers use the aerobic energy system, and because of this, these fibers are recruited during endurance-type exercise. Type 2A fibers are a hybrid of both type 1 and type 2 fiber types. They contain high volumes of myoglobin and mitochondria, and because of this, these fibers can produce strong and rapid muscular contractions, but are less fatigue resistant than type 1. To produce these contractions, type 2A muscle fibers can use both the aerobic and anaerobic energy systems. These muscle fibers are best suited to speed, strength, and power type training, such as weight training within 8 to 12 reps and fast running events like 400 meters. Finally, we have type 2B muscle fibers. These muscle fibers contain low levels of mitochondria and myoglobin. They contract extremely rapidly and produce very forceful muscle contractions, but fatigue extremely quickly. In order to produce contractions, these muscle fibers use only the anaerobic energy system. Type 2B muscle fibers are best suited to strength, speed, and power training, like heavyweight training within 1 to 3 reps, powerlifting, and the 100-meter sprint. With resistance training, type 2B muscle fibers can turn into type 2A fibers in response to increased resistance to fatigue. An individual's muscle type is not consistent throughout the body because different muscles have different properties according to their role. For example, muscles involved in maintaining posture have to be active continuously to contain a higher percentage of type 1 fibers as they are most resistant to fatigue. The soleus, one of the calf muscles, contains 90% type 1 muscle fibers, but the muscle responsible for closing the eye, the orbicularis oculi, contains 90% type 2 fibers. Take a few minutes to look over this table, which summarizes the features of each muscle fiber type, along with the activities they're most often used in. In addition to muscle fiber types differing between muscles according to their role, there are other factors that impact the fiber type an individual has. Firstly, genetics play a huge role in determining what muscle type we have. Typically, it's thought that the average person has 60% fast twitch fibers and 40% slow twitch fibers. However, some individuals can be born with higher proportions of either muscle fiber types and therefore are more suited to one type of activity over the other. Secondly, the training type undertaken can alter muscle fiber type. Over time, muscle fibers will become accustomed to the training they are exposed to, i.e., type 1 may not necessarily change to type 2, but it will become more used to the demands placed on it through strength and power training. Finally, then, our age impacts the proportion of fiber types we have. When we age, our fast twitch fibers decrease and slow twitch fibers increase. So, how do skeletal muscles actually contract? As mentioned previously, muscle contraction involves an interaction between the two proteins, myosin and actin. This occurs in a process called the sliding filament theory. After the muscle fibers receive an impulse from the nervous system, a reaction is stimulated. Heads on the myosin filament reach toward and attach onto the actin filament, causing cross bridges which pull the actin towards the center of the sarcomere. This process occurs simultaneously in all sarcomeres, which causes a shortening of all the sarcomeres in the muscle fibers, i.e., the muscle contracts. Troponin is a protein that is essential to this process. It is located within actin filaments, and when the muscle is relaxed, it blocks the myosin from creating cross bridges with actin filaments, preventing muscle contraction. There are 3 basic types of muscle contractions we need to familiarize ourselves with. They are concentric, eccentric, and isometric. When a muscle shortens under load or tension, it is known as concentric contraction. When this happens, the muscle develops force. An example of this would be in the squat. The quadricep muscles contract concentrically in the upward phase of the lift, i.e., the ascent. When a muscle produces force but lengthens, it is said to be contracting eccentrically. In the squat, the quadricep muscles will be contracting eccentrically in the downward phase of the lift, i.e., the descent. If you control this eccentric phase, you can keep the muscle under tension for longer and ensure a greater workload. When we increase this time under tension, we are more likely to experience delayed onset of muscle soreness, otherwise known as DOMS. Concentric and eccentric contractions are grouped together in their own category known as isotonic actions. This simply means that there is a movement taking place while force is being produced. When a muscle contracts but there is no change in length, the contraction is known as isometric. There is still considerable force required to ensure that this can take place. Exercises where this type of contraction is used are the plank and the wall sit. A muscle has two ends that both attach to bone, the muscle's origin and the muscle's insertion. The muscle's origin refers to the muscle's proximal attachment, i.e., the end of the muscle closest to the torso. The muscle's insertion is the muscle's distal attachment, i.e., the end of the muscle furthest away from the torso. There are several muscles in the body that have multiple insertion points. This allows the muscle group to contribute to lots of various movement patterns. An example of this is the quadriceps that have 4 sites of insertion, which is why our lower bodies are capable of completing a wide variety of movement patterns. When a joint angle changes, surrounding muscles go through a change of either shortening or lengthening, which can be called the muscle's action. So keeping in mind what we went over about the different types of contractions that muscles produce, during these movements, the muscles can fulfill 4 different roles. Firstly, we have the agonist role. This is the muscle in a movement that provides the major force in order to complete it. Because of this, agonists are also known as prime movers. They don't always just contract concentrically. For example, in the bicep curl, on the way up, the bicep is contracting concentrically, and on the way down, it is contracting eccentrically. Most movements involve one prime mover, but some have 2 prime movers that work in equal measures. Secondly, an antagonist is a muscle that opposes the action of another muscle. A primary antagonist directly opposes the prime mover. While the antagonist contracts, causing the movement to occur, the antagonist typically relaxes, which allows the movement to occur. In some cases, the antagonist actually contracts. Like in the bicep curl, the tricep is the antagonist and contracts on the downward phase of the movement in order to produce a controlled movement. Thirdly, we have fixators. These are muscles that stabilize the origin of the agonist and the joint that the origin moves across. The majority of fixator muscles are found around the hip and shoulder joints. An example of a fixator would be the rotator cuff muscles acting as fixators in bicep curls. Finally, there are synergists. These are muscles that stabilize the joint that the movement is happening around. This enables the agonist to work efficiently. For example, in the bicep curl, the brachioradialis and brachialis stabilize the elbow joint in the movement. When we look at the different muscles in the body, we divide them into anterior muscles and posterior muscles, located at the front and back of the body respectively. Take some time to go through these 2 tables that contain a summary of the origin, action, insertion, joints crossed, joint action, and examples of exercises for the major muscles in the body. The pelvic floor is a muscular sling spanning the base of the pelvis from the pubis to the base of the spine. It consists of both fast and slow twitch muscle fibers, as its functions and responsibilities have varying degrees of intensity. The pelvic floor muscles have many responsibilities, including stabilization of the pelvic girdle, the provision of support to the organs of the pelvis, the provision of support to the fetus when pregnant, and continence control. During childbirth, the pelvic floor muscles are vital, as they have the potential for a large amount of stretching to occur, which facilitates the birth of the baby. Because of this, they can be left in a weakened condition, and this will need to be addressed in exercise, post-pregnancy. Exercise causes a series of sustained muscle contractions that occur for a short or long duration, depending on the demands of the exercise. Short-term effects of exercising on muscles are fatigue and soreness due to many different reasons. Some of these being impaired blood flow, ion imbalance within the muscle, nervous system fatigue, and muscle soreness. Muscle soreness was once thought to be due to the accumulation of lactic acid in muscles, but more recently, it has been attributed to micro tears occurring in the muscle caused by eccentric contractions. The more we expose our muscles to eccentric contractions, the less we will experience this soreness. The noticeable long-term effect of exercise is increased muscle mass, otherwise known as hypertrophy. This happens particularly in response to weight training. In addition to hypertrophy, with sufficient training, the metabolic capacity of a muscle can change, which actually delays the onset of muscle fatigue. Fast twitch muscle fibers will synthesize more glycolytic enzymes, while slow twitch muscle fibers will develop more capillaries and mitochondria. Although exercise has countless positive effects on the muscular system, it is possible to actually overuse a muscle. This happens typically when the exercise program has not been sufficiently planned and has not been progressively overloaded. Muscles may not have the capacity to perform the activity they are being asked to do, and as a result, we can sustain overuse injuries. The muscular system can sustain strains or pulled muscles, while other structures can sustain tendinopathies or stress fractures. Underusing muscles can be just as detrimental to our bodies as overusing them, and typically causes muscular atrophy to occur. This is the loss of skeletal muscle mass, which leads to muscle weakness and, over time, can cause disability. So finally, we'll take a brief look at some considerations that should be made when dealing with special populations. First off, we need to be careful when training children. Because growth spurts take place at different points during childhood and adolescence, children can be left a little awkward and uncoordinated. Excessive training can result in multiple different injuries in children, typically occurring in the knees, growth plates, and where tendons and ligaments insert into bones. A balanced approach should be taken when training children in order to develop muscles in the whole body. Secondly, we need to be careful when training pregnant women. The hormone relaxin is released during pregnancy and is responsible for increasing the pliability of connective tissue, especially in the latter stages. We should avoid development stretching during this time and focus only on maintaining flexibility and mobility they currently have. Now, when we age, the overall quality of our tissue declines along with muscle mass. This causes reduced power, strength, and endurance, which can result in gradual changes to posture and impaired motor skills such as balance. Because of this, we must include resistance training in programs for the aging populations to help prevent and slow down the degeneration of the muscular system. If any of your clients are hypertensive, you should discourage them from holding their breath when weightlifting. There is a technique which is commonly used in weightlifting where you take a deep breath in and then exhale against a closed airway. This is called Valsalva. This should be avoided by clients with high blood pressure. There are more medical conditions and disabilities that can negatively affect our muscular systems and structures. If you are not appropriately qualified and certified, you must seek advice and assistance from someone who is.